guys, this video today is not the norm video. I just want to share that you all know, like, because I have put different videos on my channel, but I just want to offer variety, and then it's just more to me than hair and makeup and all that stuff. So I want to share more of that, more of that, and then maybe you could get a sense of my personality, because I am an introvert. But if I am passionate about something, you would definitely hear my voice. Or if I feel like I need to tell you about yourself, you would definitely hear my voice. But other than that, if I find it that important, I will speak about it. But if I really don't care, I'm not going to speak about it. So I am an introverted by nature. I am a dental assistant, dental technician, expert technician, whatever you want to call it. That's what I am. I've been a dental technician for about 6 years, I want to say. I do have a 9 to 5, but pretty much the clinic I work with is very, very unique. It's very, very unique, and maybe later on I'll share how unique it is. In saying this, I see a lot of cases. Well, yeah, I see a lot of cases. I'm going to start doing maybe just a small video on my dental care, and I felt that it was important because I know for a lot of people, we lack the education and the importance of dental care. I feel so sad and like disheartened at times when having a patient and the first thing, they say, well, I haven't been a dentist for 10 to 20 years, or I haven't did this and I have did this, my teeth is horrible, they ugly, this and that. And I hate sometimes they feel like when they first see me, if I'm taking any x-rays or whatnot, or assisting a dentist, that's the first thing they gotta tell me. And I feel bad because I know for a lot of them, they don't know how to properly take care of their teeth. And the first thing I always hear is, I hate dentists. I hate dentists. And that's just because, like, a lot of us don't know we don't have the education. And it's like, for a lot of us, it wasn't taught to us. So therefore, by the time you get the proper education, you don't really have teeth, or you have so many feelings by that time. So, and there's no shade at all, because I really feel like this is so important. By nature, I automatically look at people's teeth because I look at teeth all day, all day. But I let you know, I don't judge anyone by their teeth. Society built up, they're so built up on having a perfect smile, and it's no such thing, because teeth in its own brings personality. I don't care how straight or how white your teeth are. Some people just have that perfect smile that when they walk in a room, they can warm up a room. Or if you're down and if you see that person smile, it just do something to you. So a smile is a winner. Therefore, it doesn't have anything to do with straight teeth and this and that. It don't have anything to do with it, with a perfect white teeth. It doesn't. Now, don't get me wrong. If you feel like that's something that you're insecure about, or there's something that you want to do and you want to correct it, by all means do so, because I might probably get mad stuff. I don't want us to get so hung up on the perfect white smile when we don't even know the basis of taking care of teeth. A lot of them tell me, well, I didn't know that, or my parents, they have dental care. We went to the doctor, but we didn't see the dentist. And then you see them like, oh, it's just so sad when a lot of them have to get their teeth pulled out. I feel like I really, really hope this video may help someone. And just like if you, and I don't think a lot of us even think about our teeth. I think a lot of us feel like if we just brush our teeth, that's it. We're good. And then even when it comes to like bad breath or whatnot, like a lot of people is not going to tell people they have bad breath or whatnot. They just not going to do it. So a lot of us don't even know, for most part, if we really have bad breath, because a lot of people won't let us know that, because it's just a sensitive topic. I really hope that with the tips that I'm about to discuss, it can really help someone, or maybe even like if you had a question like this question way back in your head about your teeth, that maybe someone in this video there is answer. And then if you feel like you need to see a dentist, if you don't go to see the dentist on a regular, then maybe this will give you the courage to do so. And like, don't be embarrassed. Like, if you don't know better, how can you do better if you don't know anything? If you don't know better. So please don't get embarrassed. Much with teeth concerned, number one tip is, like, of course, make sure you at least brush your teeth twice a day. At least twice a day. I say that because in reality, we know a lot of people have a busy schedule. Like I said, people don't really feel like their teeth is as important. You know what I'm saying? You want to make sure you floss your teeth. You want to make sure you floss your teeth on a C shape. I should get my floss. Maybe I do in a different video. On a C shape. Round around the tooth. You want to make sure you floss all the way up to the gum area. So pretty much between the teeth, because a lot of people where, you know, they might not have any cavities on the surfaces of their teeth, but they have it in between their teeth. You have people who definitely brush their teeth twice a day, but they don't floss, and therefore when they don't floss, they end up having cavities in between their teeth, and they're called incipients. So that's just dental talk. Get your cleanings done every 6 months. If you're anyone who experienced any type of gum disease in the past, you want to make sure you stay on it at 6 months. You know, now, you know, it has changed. It was like once a year, this and that. But if, like I said, if time just, not even saying you just can't get those cleanings within every 6 months, at least try to get your cleaning once a year. I like for you to have your cleaning every 6 months. It's just so much better for you, for your teeth and your gums. I hear things like, well, you know, man, I started flossing, but my gums bleed real bad, so I stopped. If your gums are bleeding, that's a sign that you really need a deep cleaning. That means you have the gums are irritated from the food that's been sitting there in between your teeth. Imagine the more you eat, the more you pack in the food into your gums, and it causes some type of bacteria that inflames the gums. Now, if your gums are red, that's a sign that you have some type of gum disease, and pretty much a toothbrush and floss is not really going to help. You really need to go seek a professional and get your teeth clean. So if you notice any bleeding every time you brush your teeth, actually gently sending the floss between your teeth and barely touch your gums and your gums are bleeding, that means you need to clean it. And there's no toothbrush, no mouthwash, no home remedy that you think is going to clear that. You really need to go see the dentist to get that out. Because what happens if you continue letting it happen, like you already have gingivitis, then you have periodontitis. That means a disease with the gums. So pretty much it's going to start attacking your bone structure. Once the bacteria starts attacking your bone structure, you're losing your teeth. So that's how important that is. If you get the embarrassment, forget how much it hurts. Because most times, if you have that much calculus on the gums, they might have to give you a few shots to numb you up, because it's called deep scaling. They promise you, once you get your deep cleaning, or, well, I'm talking about the ones who have a severe problem, like they haven't seen the dentist in a while. But anywho, once you get your deep cleaning, after a while, the gums will heal up, and then you will notice there'll be no bleeding when brushing your teeth. So it's so important. Nowadays, the way the foods are and stuff like that, you're so prone to getting some type of cavities. Now, for ones who don't have cavities and in adulthood, much power to you. That's a great thing that you don't have any cavities. But for a lot of people, it's so easy to get cavities now. It's like really crazy, right? Now, tip one, make sure you brush your teeth twice a day. Make sure you floss. I prefer like to floss. I almost floss almost every time I eat, just about, you know, but I'll at least get my floss in. After you get your professional cleaning done, if you hadn't had it done, what I like to use is, preferably I like to use Sensodyne. I just bought this one, and I'm Sensodyne crazy. I don't know if you see this. Sensodyne is great for like what?
You calling me?
No, I'm gonna call you. For sensitive gum, well, you can buy the one that's for sensitive gums. I had to actually get a few small fillings myself, so now my teeth are sensitive. I never had sensitive teeth. I can literally bite into ice cream and drink cold water. Now got a few fillings there. Now my teeth are sensitive. So I'm not a big alcohol drinker, so, or a wine drinker. Not that I'm against. I don't do it all the time. So therefore, if you drink a lot of wine, drink a lot of citrus type of drinks like orange juice, and even if you put a lot of lemon and lime in your water, that can actually wear off the enamel of your teeth. So if you see your teeth like the others, I don't know how much you pay attention to your teeth. Look, spots like that, that means the acid is eating at your teeth. And if you're the type who let it sit there for hours without, and this is what I recommend, if you drink wine or if you drink any type of citrus type of drinks, always rinse your mouth or drink water right after that so it won't sit on your teeth. If you don't have good dental hygiene, what happens is your teeth is more prone to getting cavities. Act. Now, Act is about $7 off. but this like one of the best. Get the one for sensitive formula, and it's alcohol free, and it's a fluoride mouthwash. So pretty much from every time you brush your teeth, you want to rinse with a fluoride mouthwash. Act. It's $7, but it lasts long. You want to rinse with a fluoride. So what fluoride do, it helps strengthen the teeth. Now say for instance, those cavities, them starting cavities in between the teeth, which I say called incipients. What Act does, it keep those in cavities, them starting cavities, to be just at the start. And the fluoride, you know, gets between the teeth or whatnot, and it kind of controls that, so you won't have a full cavity. And then when you have a full cavity, that means you have to go into a dentist and they have to fill the teeth in. Act is like one of the best mouthwashes that I can recommend just to use. I mean, it helps prevent cavities as well. And I say this in regards of you making sure you're doing everything I have mentioned already in your dental hygiene. You want to use Act. I mean, sometimes I just like to use it in between the day, just to use it. Most time when you use those fluoride mouthwashes as such, it's Act. You can't eat or drink anything for 30 minutes. For as flosses, they have so many different flosses on the market. They cater to, like I said, our teeth are different. Our teeth are unique. Our teeth, unfortunately, it identifies us if, you know, if something happened to us, like for us death or we're missing. We use teeth to identify you if we cannot find another way to recognize who you are. So teeth are very important. I want us to know how important teeth really are. You brush your tongue. I like to brush my cheek area. And I also like to brush my lips. A lot of people don't brush their lips. And imagine, you know, you going throughout the day and you eating all this type of stuff. A lot of us might lick the lips just out of habit, or don't even realize we lick the lips. And that's more bacteria that's on our lips. And then we find out, okay, we brush our teeth, but we still have a smell to us. Cut off. So anywho, I'm trying to figure out what else. Oh yeah, so make sure you are brushing your lips. I like to use an electric toothbrush. Now, your choice electric toothbrush is on you, but preferably I like to use the round one, the one that look like the actual brush they use in a dental office. I don't really like the electric one that's shaped like a manual toothbrush or regular toothbrush that you use yourself. That's just my preference. It's not a big. If you never used a toothbrush before, you don't know what you're missing. I'm talking about they're gonna have those brushes that make your teeth feel extremely clean. Like every time you brush your teeth, you just came from a dentist. Like so serious. Those brushes are like the best. The one I have is the Oral-B, and I think I have the 1000 series. I think I'm gonna eventually get the 3000 series. I'm not sure. I think it's 3001, but I have the 1000 series. So I've pretty much had that toothbrush for maybe three or 4 years now. Yeah. So they come with exchangeable type of heads that you put on there, and pretty much how you know when to change the head. Well, it tells you within 3 months, or the color. I believe it's a color, like a color code thing they go by on the brushes. And I believe when it turns light blue, for my particular toothbrush, when it turns light blue, that's when it's time to change the head. So with that being said, it's either 3 months or when that toothbrush wears down first, the color. But they have exchangeable heads. Now those exchangeable heads can be like expensive, just because I can be cheap in certain stuff. But I think they're like $25 almost, and you get like 3 to 4 heads. But then you think about it, like you're supposed to be changing your toothbrush like every 3 months anyway. So it's like anyway, it's the same difference really when you think about it, to use those. And when you're brushing your teeth, you want to brush your teeth. A lot of people brush their teeth like this. That's a no-no. Please don't brush your teeth like that. You are wearing off your enamel. What I talked about early on, you're wearing your enamel. You're going to find that your teeth going to have these little scrapes in it. The teeth appearance will look thin if someone's up close. And that's just because you're brushing too hard. That's why I said when you get an electric toothbrush, it's much easier, because it lightens up the force you using manually to brush your teeth. Second, when brushing your teeth, you want to brush your teeth along the gum line. So you want to brush like kind of like this, along the gum line. And pretty much if you're using an electric toothbrush, it's going to do the work for you. You just pretty much going to let the toothbrush sit there and moving on the gum line. A lot of people neglect the gum line. They do not brush actually by the gums. They just brush the teeth. And what happens is that plaque, the white sticky stuff, gets stuck at the gum lines. It hardens and it creates a cavity. And some areas create tartar, that little black stuff. And make sure you brush the teeth along the gum line. Make sure you brush every surface of the tooth. Make sure you brush in the back of the tooth. The lingual, I don't want to say lingual because that's dental, but the side that's closest to the tongue area, the sides of the cheek area. You want to brush every surface of the tooth, so that'll help you from getting any cavities. You have some people, okay, they're really good about brushing the gum line, but they're too hard. They brushing too hard because they really trying to get those teeth clean. And like, my head go off to you when you really, you know, into your dental hygiene and you into your perfect smile or your smile period. But what happens is when you brush your teeth too hard by the gum line, the gum recedes. So pretty much the gums start lifting higher and higher. And what happens is you'll find that your teeth get sensitive to hot or cold, sweet, whatever. And that's just because you brush it so hard that you're wearing off your gum area. And what happens is it's possible that the root starts getting exposed, and it might get into like getting fillings just because of you wearing your gums out for brushing your gums too hard, or it can result in a root canal, you know. And you all who have root canal, you know what I'm talking about. I don't have root canal, but I'm just saying you know what I'm talking about. And that's pretty much where they have to take the nerve out, that physical tooth, and put some type of substance, rubber substance in there to block that area, and then they give you all these crowns or whatever fillings on your teeth. And you all know root canals can be cost a lot of money. So why? To avoid, you know, receding at the gums, or to avoid cavities at the gum, I really highly suggest that you use an electric toothbrush. I think I covered the basics of dental care, dental hygiene. Alright, so I just go through it one more time. Tip 1, make sure you brushing your teeth twice a day. Number 2, make sure you flossing. Now, if you can floss pretty much almost after every time you eat, then that's a plus. But if you don't, make sure you definitely floss after your major meals, at least twice a day when you brush. But also mainly make sure you floss at nighttime. Mainly, if you can't do it twice, please floss at nighttime. Number 3, make sure when you brush your teeth, make sure you brush by the gum line. And you want to kind of do it like this wave motion, not too hard, not too hard. Make sure you brush all surface of the teeth to prevent any cavities. Tip number 4, I definitely suggest that you use some type of mouthwash, preferably Act, something that has a fluoride in it, so therefore it can prevent you from having cavities. And if you have any starting cavities, which are called incipients, it would prevent that to be a full type of cavity. 5, don't forget to brush your tongue and your lips. So important. So a lot of people neglect the lips. Like, please don't neglect the lips. Brush those lips. Tip number 6, right? Tip number 6. Make sure you go see a dentist. Make sure you get your regular cleanings twice a year. So every 6 months you want to get a cleaning done. Tip number 7. Make sure you get an oral cancer screening, especially if you're a smoker. Alright guys, hope you enjoyed this video. If you feel like this video is helpful to you all, if you feel like some of these things mentioned in the video has helped you with those questions in the back of your head, and now you know what may be the problem for you all, thumbs up. And if you'd like to see more stuff, it's more stuff I definitely can share on dental care. If I had the knowledge, I'm more willing to share it. Make sure you comment down below. And like I said, I can make this a once a month thing, or every 2 weeks. I don't know how much I could talk about on dental care, but maybe like a once a month thing. If you feel like there's more things that you're just not sure about, go ahead and comment or ask down below. And like I said, I'm no dentist, but I'm around a lot of dentists. So if I don't know the answer, I could definitely get the answer for you. And yeah, I appreciate you all watching and supporting this channel here. And like I said, yeah, you know, if I could share more information that you just don't know what's going on, I am willing to. Alright guys, till next time, bye. Bye.